This story now, there's growing concern about the increasing number of COVID-19 cases in the mining sector. AngloGold Ashanti's Mponeng mine has been closed after 196 miners tested positive. Now, to discuss this, we're joined by Meshek Mbangula, who is from the Mining Affected Communities United in Action, and he joins us from Ekurhuleni this morning. Mr. Mbangula, thanks for your time. I want to focus the attention on these AngloGold Ashanti mine workers at Mponeng mine. The company issuing a statement last night saying that isolation facilities have been made available. Do you know if any of these workers are in those isolation facilities right now?
Yeah, thank you for having me this morning. In fact, most of these workers are residing in the Merafong area, which is Khutsong and other areas. So we know them very well, and the serious concern is only if those workers are only treated, tested, screen tested and isolated. What about the communities that they come from, in the communities? So the number is it's very high because they come from these communities. And what we said initially from DMR is to not only test the workers, but the communities where these people come from, because that's very important.
And that's why I'm asking you this question, Mr. Mbangula, as to where are these 196 workers now? Because if they are allowed to still live in their communities, how are they able to self-isolate?
That's where the problem is, because what we indicated is the isolation place should be known. Where they're treating the place should be known. Where they're testing the people should be known. But unfortunately, most of these decisions are done without communities being part of that decision making. So we're not aware. And those who are so-called not that much sick, they want them to isolate themselves for 14 days, it's a problem.
Yeah.
Because we have much places for those now 194 people to be isolated, which give us a very serious problem.
Now, I want to know from you the reaction from the communities you've listed, among them Merafong, from where these 196 come from. What's been the reaction from the community after so many workers have tested positive almost at the same time?
Yeah, in fact, nationally, where we have the mines starting at 50%, what we have discovered is most of these people come from around communities. And the communities were supposed to be tested, screened and tested as well, because we believe that the mine have the ability to and can able to do all those testing. So the number is quite very high, because the communities were supposed to be part of the making the health and safety guidelines, so that they can be able to see how much is the number of the people. So this doesn't really work if only we check the workers when after that they go back or they come from the communities. That means they left the communities already positive with this virus.
Yeah.
So
that's why I'm asking you the question. I'm sorry to cut in here. I'm sorry to interrupt you.
Are shocked and unhappy.
I want to ask this direct question to you. Are communities worried that there are so many workers who live in and around their community who have been infected with the coronavirus? And importantly, how educated are communities about this virus?
Very little communities are informed about this virus. They only see it on TV. But communities are not only worried, they are very seriously concerned to say some of these people are from their areas, some of these people hired rooms in these areas. So they definitely know that there's a possibility of them that is they're positive. And nothing has been done about screening them, testing them, because we believe that the mine should not only be interested in workers to make profits, but should be as well test the community. But nothing has been done so far. And over and above that, we asked Department of Mineral and Resources to make sure it enforce the mines before they start. That is, not test only the workers, because they come after work, they become communities.
Yeah.
That means they affect the communities. But that, as we speak, the communities are isolated, are not given any attention around this area. So communities are seriously concerned, worried about this not being taken into consideration to make sure they are safe.
Final question to you, Mr. Mbangula, and very briefly, please. The company involved here, AngloGold Ashanti, says it's been playing a very proactive role within the community, whether it be providing resources. What kind of support have you seen thus far coming from this mine?
Let me say this. We have, as Makua, done what we call social audits around the issue of social and labor plans, which are there to make sure that they help the people. But what happened is 99% of that supposed to be done in the community, supposed to improve the life of community, can be infrastructure, bursaries for the kids, and nothing has happened. So Mponeng mine, Ashanti, what they're talking about, it's really not true, because we have done our audits around the social and labor plans and nothing has been done. And they're doing nothing now with the issue of coronavirus, which is very dangerous.
All right. We thank you very much for your time, sir. Mishak Mbangula, he is he represents an organization that speaks on behalf of mining communities. Thanks indeed for your time.